Hey guys, this is Dr. Jean-Guy, and today I'd like to talk to you about this word, it's called pain, right? Who is not in pain and who doesn't have pain at some point in time in their life? Maybe there's many of you right now, some of your friends, you have pain all the time, right? You have, what we call chronic pain. And I'd like to just kind of educate you a little bit about pain today, that if you'd like to write down pain and right next to it, you should write down inflammation. And because those two words, they come together. And the reason why they come together is you can take 100 diseases that are chronic illnesses by nature, and if you look at them, you can funnel them down, right, to this one word. It's called inflammation. And then a lot of time also involved with that is the pain. So there's kind of two kinds of pain, meaning that a person can have pain for a lot of different reasons, but one of the reasons is if you are not mechanically sound in a gravity environment, that's going to be a problem. For instance, in my world of chiropractic, if a person was to have a spine that is out of alignment, that is crooked, right, and then you have some joints that are having abnormal pressure on the joints and on the nerve that you have abnormal mechanic, that things are just rubbing on each other, well, guess what's going to happen? Your body's ways of protecting itself is by sending messages to your brain that there's a problem, and how the body does that oftentimes is by pain, by you perceiving pain. Then you have another type of pain is a person can have, the pain can also be caused by an inflammatory reaction. So what that means is if you were to, I'm sure some of you might not like to hear that, but if you eat a lot of cake, cookies, candies, ice cream, bread, rice, and pasta, or anything that is either sugar or turned down into sugar, then what happens is it feeds this pathways into your brain that as a result of that you increase the inflammation, and the inflammation will be causing more pain. If you have a lot of fat, or not the fat that you should be putting in your body, because I think that you should be eating some good fat at every meal of the day, every day, 7 days a week. However, if you eat some fried food, or if you have a lot of vegetable oil, or if you have, things that have been man-made for the most part, those have the tendency to cause inflammation in your body. MSG will do that as well. So anything that is chemicals in nature, right, or things that are artificial sweeteners, or, things that you might be sensitive to, all of those things can cause inflammation. As a result of that, you can have more pain. So pain and inflammation, they come together, right? And I just want you to know that if you have pain for a long time, you just got to find out what's causing it. You got to go down this list, right? So this is really important for you to be able to seek the answer. Celebrex is not going to fix it. Vioxx is not going to fix it. A cortisone shot is not going to fix it. I mean, temporarily you might feel better, right? But I want to encourage you today to make sure they understand is what's causing the problem, right? You want to find out what's causing the problem. Because if you can get to the cause, right? If you're driving your car and the service engine light comes on, you don't put just duct tape over it, would you? I know some of you are laughing right now. You're like, well, that sounds like a good idea. I could drive, right? I wouldn't see the light. However, right, we want to find out what's causing the problem. Does that make sense? So hopefully this was helpful, and we'll talk to you soon. Take care.